So in the middle of an overnight, I was consenting a patient for a procedure, and when I was looking at the date and time for the consent form, I said to myself, February 18th, I've been sober for a year. And this isn't something I've really shared with other people because it's a little embarrassing, right? Like, I'm still in my 20s, and I feel like it was a necessary thing for me to stop drinking. And the story behind it is last year, around this time, when my wife and I decided we wanted to have a second kid, she decided I should probably stop drinking if we're going to have a second kid. And I, being her husband, I was like, that makes sense. I should do that too. And like many other people during COVID who were drinking more regularly, and especially in a field like emergency medicine where drinking culture is pretty common, and the time at which people drink can vary wildly because people can get a post-shift drink if their shift ends at 5 or 1 a.m. or 8 in the morning after an overnight, whatever. It's widely accepted in our field. But a couple days and weeks into not drinking anymore, I was saying to my wife just casually, like, this is like really hard for me not to drink. Like, I'm thinking about it a lot. And in that moment, she was kind of like, yeah? And for whatever reason, that moment, I was like, I have a problem. And anyone who knows my family, this isn't a surprise, right? I come from a long line of relatives who have varying degrees of substance use issues and varying levels of sobriety. And even as a doctor, you intuitively know there are people with risk factors. There are lifestyles with risk factors for substance use disorders and binge drinking and whatever. But when it comes to yourself, like when you have kids, that knowledge doesn't sit the same way because it's yourself. It's not you talking to a patient. And I've learned a lot about myself being sober, and I was using it a crutch for a lot of things, especially during intern year. There's all medical ICU or tough shifts, they come to an end, but you can just have a drink afterwards, kind of forget about it, unwind. And you could have 2 drinks or 4 or 5. But through therapy and reflection, I learned that I was just saving all of that introspection for the future. It has to come out at some point, right? And after that first couple months of sobriety where I was like, wow, this is really hard to not think about all the time, I was rewarded in the following 3 months of, wow, look at all this personal growth and reflection that I'm having now. Like, this is so great. I wish I did this sooner. And then the second 6 months, it was kind of boring. It was kind of boring. Like, I'm not like growing a ton anymore. Like, maybe I caught up on all this introspection that I wasn't able to do before. But then if I would go to social functions or like out with friends or whatever, and people would have a drink or two, that immediate thought of like, I need that. I really want that again, was a good reminder of maybe I should probably continue not to drink, right? Like, if I immediately would flip back, if there was access to alcohol and I was like, I really want to do that again, probably a good reminder of me to like continue to continue being sober, right? And I think I've just decided to myself I'm not going to be ashamed of it anymore, because there are probably a lot of other people in medicine or training or in my field or whatever who are going through a similar thing right now. And I think there's a component of drinking in my generation is going to have some consistency between smoking and the generation before me. How sobriety is going to be more common and accepted. And for some people, they can drink and it can not be a problem. But I think I've settled with the fact that I don't think I'm that person. And I'm choosing not to be ashamed of that anymore. So if you're in training, or if you're using drinking as a coping mechanism, or you have unhealthy relationships with drinking and you're young, you're never too young to have a problem or to want to find help for it. So if there's anyone out there who's dealing with something similar, just know that you're not alone.